Hello dears, welcome to Ezinurse. Today we have a discussion on ECG or EKG, that is electrocardiogram. Whether you are a medical student, nurse or paramedic, you are really curious to know about how the heart speaks through electrical current. Yes, you are in the right place. Today we have a discussion on ECG here. Let's move on the slide. The definition of ECG. Yes, it's a non-invasive test. That means we are not inserting anything into the patient body. There is no surgery, no needles. Instead of that, we are placing some electrodes over the patient arms, legs and chest and records the electrical activity of the heart. So we are collecting the electrical signals from the heart and it is collecting through the ECG machine and into a waveforms, providing information about its rhythm and rate. The rhythm and rate. By analyzing the ECG, especially we are focusing on the rhythm and rate. If the rhythm is regular or irregular, or the heartbeat is fast or slow, that we are getting after taking the ECG. Next will be the indications. What are the situations we are preferring to perform ECG? Let's move on that. The first will be the symptoms suggestive of heart problems. Yes, the symptoms will be related with the heart problem, especially the left-sided chest pain. If the patient is experiencing left-sided chest pain, then we should recommend the patient to do the ECG. Next will be the patient is feeling tiredness, restlessness or fatigue. Then we should recommend the patient to do the ECG. Next will be the diagnosis and monitoring of heart condition, especially by diagnosing the cardiac dysarrhythmias, and after the cardiac surgery, if the patient is having pacemaker, we should perform the ECG to assess the heart function. Other indications. It would be really interesting. The other indications will be the preoperative assessment. It is a preoperative protocol. Before the surgery, we should perform the ECG for the patient, and the pre-medical checkup. Before the working the pre-employment medical checkup, we should assess the heart function of the patient. Next will be the contraindications. Let's talk about the contraindications. It's also really interesting part. And here we are discussing about what are the situations we are making delay to take the ECG. The patient refusal. Sometimes the patient may refuse to take the ECG. So we should respect the patient. So every procedure we should take the consent before the procedure. If the patient is refusing the ECG, so you should inform the patient by a polite way about the purpose and indications for taking the ECG. Okay, and convey them to take the ECG. That is important here if the patient is refusing the ECG. The next will be the allergies and sensitivity to adhesive. Some patients may allergy to electrodes, especially the latex allergy. Instead of that, we can place some non-latex electrodes over there on the patient body to avoid this situation. Next will be the conducting system of the heart. It is the fascinating part of the heart. So here we are going to discuss about the electricity of the heart. Okay, this is the heart. So here the conducting system of the heart is starting from the SA node. This is SA node. The SA node is situating the junction of the superior vena cava. This is superior vena cava. This is right atrium, left atrium, right ventricle and left ventricle. So the SA node is situating the junction of the right atrium and superior vena cava. The electrical impulse starts from the SA node, and the SA node, the electrical impulse traveling through the AV node. The AV node is situating the intra-atrial septum. So then the electrical signal is passing through the bundle of His, and then the bundle of His is divided into two branches, the right bundle branches and the left bundle branches. Okay, so the end of the right and left bundle branches, we can see some narrow-like structures that we can call it as a Purkinje fibers. That is about the conductive system of the heart. We can go in detail. The first is the SA node. The SA node, we can call it as a natural pacemaker of the heart. The heart is initiating the electrical activity from the SA node, and the SA node is producing the 60 to 110 beats per minute. 60 to 110 beats per minute. Then the electricity is passing through the AV node. The AV node, we can call it as a backup of the heart. If SA node is failed to initiate the heartbeat 60 to 110 beats per minute, then AV node will help to initiate the heartbeat. The AV node can initiate the 40 to 60 beats per minute. Got it? Okay, then there will be a thread-like structure. Okay, you can see it is a blue color, that is about bundle of his. The electrical signal is passing through the bundle of his, then the bundle of his is dividing into the two. One is left bundle branch and right bundle branch. This can produce the 20 to 40 beats per minute. 20 to 40 beats per minute. That's about the conducting system of the heart. So here the SA node is starting to produce the impulse, then it is traveling to the AV node. From AV node, the bundle of his is carrying the electrical impulse, and it is divided into two branches, left bundle branch and right bundle branch. End of the right and left bundle branch, there will be a narrow-like structure that we can call it as a Purkinje fibers. So here we can go in detail regarding the ECG. So here, as I told you that the SA node is producing the impulse. Okay, so as a result of SA node is producing the impulse, the right atrium is contracting the first. Then the left atrium will contract. Okay, so then electrical impulse traveling to the AV node. Then that time, as a result of the contraction of the right atria, the blood is pushed into the ventricle. Okay, there will be a pause will be there. Okay, so then the Purkinje fibers and bundle of his will be there. These helping to pass the electrical signals. Okay, so as a result of full ventricular contraction, the QRS complex is forming. As a result of complete atrial contraction, the P wave is forming. Okay, so that is about atrial contraction, that is atrial depolarization. As a result of atrial depolarization, the P wave is forming. As a result of complete ventricular depolarization, the QRS complex is forming. Okay, so then let's move on to the PQRS rhythm. Okay, so here, as I told you that the electrical signal is starting from the SA node. Here, this is a straight line. We can call this line as an isoelectric line. There is no electricity. Okay, so this will be the P wave. See the shape of the P wave? It is a round shape. Okay, so the SA node is producing the impulse, and the impulse is first helping to contract the atria. As a result of the right atrial contraction, the half of the P wave is forming. Okay, half of the P wave is forming. So then the left atrium is contracting. As a result, again the half is forming. When the right and left atrium is contracting, the complete P wave is forming. The P wave shape will be the round shape, the small round shape. Okay, so in ECG you can see that there will be some columns will be there. Okay, and each small columns will be 0.04 second. Okay, so the first we are discussing about the P wave. So the P wave is forming as a result of atrial contraction. Then we should look at, when you get an ECG, first you should look at the P wave. Okay, the shape will be the round shape. Okay, then you can assess the how many columns will be in the P wave. Okay, if the P wave is normal, then there will be the 3 columns will be there. 1, 2, 3. And each column will be the 0.04 second. So the 0.04 into 3, what would be the result? That is 0.12 second. 0.12 second. Okay. So the P wave is forming. It is a round shaped and the 3 small columns will be there. The second will be the 1.12 second. Okay. Then here we completed about the atrial contraction. Then the electrical impulse is traveling through the AV node. Okay. So the AV node is forming. Here is a negative deflection, then again a positive deflection, that is R wave, then again a negative deflection. Okay, this is QRS. This is QRS complex. See the shape, this is tall peak shape. Tall peak shape, that QRS complex. Okay, so the P wave will be the round shape, the QRS complex will be the tall peak shape. So the QRS complex is forming as a result of the whole ventricular contraction. Okay, okay. Then we can discuss when you get the ECG. So first you have to look the P wave, then you should check the QRS complex, then PR interval. The PR interval from P wave to R wave. Okay. P wave to R wave. So here also I already said that the 0.04 second for each small columns. So here it will be the 5 columns. Okay. So you can see the between P and R waves there should be 5 columns. Okay. So 0.04 into 5. What would be the result? 0.20 second. If there is in PR interval, there is a 5 columns, that is 0.20 second, then it will be normal. The PR interval is normal. The P wave will be the 3 columns and PR interval will be the 5 columns. The each columns will be the 0.04 second. Okay. Then about the T wave. The T wave is forming as a result of the repolarization. We already discussed about the atrial depolarization and ventricular depolarization. The atrial depolarization, that is the contraction of the atria, and the ventricular depolarization, that is the contraction of the ventricle. So here the T wave is forming as a result of ventricular repolarization or complete heart relaxation. So suppose, so if you contact with the electric plug, what is happening over there? When we contact with the electric plug, so we are getting the electric shock. That time what is happening over there? Your muscles are getting contract. The same is happening here in the heart. When the electricity is passing through the heart, then the heart muscles will contract, then relax. So as a result of ventricular repolarization or complete heart relaxation, the T wave is forming. So you can compare with the P wave and T wave. See the shape, the P wave and T wave, the shape is same. The both are round shape. Okay. So the difference between the P wave and T wave is, the P wave is the smallest wave and the T wave will be the large one. The compared to the P wave, the T wave will be large. Okay, so when you get ECG, so you can mark always the small round shape one. You can consider it as a P wave, and the large, the compared to the P wave, the T wave would be large. Okay, the large round shape will be the T wave. Okay. So we discussed about the P wave, QRS complex and T wave, and here we discussed about the PR interval. Clear? Okay, I hope that you have got a clear idea regarding the conductive system of the heart and ECG waves. Then let's start to analyze the rhythm. Is that okay? Yes, we can start to analyze the rhythm. And the first rhythm will be this. Okay, so here you can see that when you get an ECG, first we have to check the P wave, then PR interval, the QRS complex and T wave. Okay, that is the steps to assess the ECG. Okay, look at here, the P wave is here. Here, the P wave is here, but there would be the 2 columns will be here, right? So if there is a 2 columns, then P wave is not normal. Then QRS complex, this is QRS complex, that is tall peak shape one, it is normal. Then there is no definite T wave and the P wave here, again the P wave, but there is only one column, and the QRS complex normal. And here is also P wave, there is only the 2 columns, and here is 1 column, and here is only 2 columns. Okay, see, this is P wave, Q, R, S. P, 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 Q, R, S. Okay, so here the P wave is not normal. If the P wave is not normal, then we can call the condition as atrial. Okay, what are the criteria for assessing the P wave? The shape would be the small round shape, and there will be the 3 columns will be there. Here is not 3 columns. Okay, then if P wave is normal, if P wave is round shape and there will be 3 columns, then we can say the P wave is normal. Then we are calling it as a sinus. Okay, so here we can call it as the P wave is not normal, then we can call this as an atrial. Okay, we can call it as an atrial. So look at the P wave, the shape of the P wave. The P wave is little bit round shape, but it is fibrillating over there or shivering over there. Okay, so we can call this condition as an atrial fibrillation. Atrial fibrillation. And one another criteria will be here. So look at the RR interval, the space between the RR intervals. Look at the space between the RR intervals. So this is very short, and this is little bit large, lengthy, and this is lengthy, and this is short, and this is also short, this is also short. See the RR interval. So the irregular RR interval will be here. RR interval irregular. If the rhythm is atrial fibrillation, then P wave is fibrillating over there and the irregular RR interval. But the QRS complex is normal. So this rhythm would be the atrial fibrillation, right? Okay, so we can check the next rhythm. Is that okay? Okay, the next rhythm. Okay, so we can again start with the P wave. Look at here, here is no P wave. And see, the QRS complex is okay. The QRS complex is okay. But here the multiple P waves will be there, right? The T wave, and here will be the multiple P waves. See the multiple P waves here. The many P waves will be there, QRS complex. And see the shape of the P wave is just like a sawtooth appearance. See the shape of the P wave. The sawtooth appearance and multiple P waves will be there. So if the rhythms with the multiple P waves and the sawtooth appearance, then we can call the rhythm will be the atrial flutter. Okay, so it's really easy, right? Then we can go with the next rhythm. So look at this rhythm. So here we can't see the P wave. There is no P wave and there is no T wave. The P wave is not here and T wave is not here. But the QRS complex is here. So I already said that the QRS complex will be the tall peak shaped one, right? The tall peak shaped one. So here it is, the shape is not tall peak shaped one. So the QRS complex would be the void QRS complex. Okay. The void QRS complex. See the shape, the void QRS complex. So then we can call this condition as a pulseless ventricular tachycardia. Okay, so we can go with the next rhythm. See, look at this rhythm. So here we couldn't determine any of them, right? The QRS complex is here So we can consider it as a QRS complex. But it is unable to determine, right? Then what about the P wave? There is no definite P wave. There is no definite P wave. This QRS complex and no definite P wave, and there is no definite T wave. Then we can call this condition as a ventricular fibrillation. Okay, so we can go through the next rhythm. Look at this rhythm. It is a straight line. Okay, straight line. So we can call it, there is no electricity. So we can call the rhythm is a flat line protocol. Okay, that is asystole. When you get this rhythm, first what you should do? So first of all, you should check the electricity connection between the patient and monitor. Okay, if there is a connection is proper, then you should start to do the CPR, chest compression. Okay, so sometimes we may get ECG if there is a disconnection problem. Okay, there will be a chance. Okay, when you get this ECG, the first important thing, you would check the connection between the patient and monitor, then electricity connection. That is about the asystole. Okay, so here, so we already discussed about the atrial fibrillation, atrial flutter, pulseless ventricular tachycardia, ventricular fibrillation. So here the pulseless ventricular tachycardia and ventricular fibrillation, these are the two rhythms. We can call it as a shockable rhythms. Okay, when we get this rhythm, so we should deliver the shock. We are using the defibrillator, and we discussed about the atrial flutter and atrial fibrillation. These are the situations we are using the cardioversion. See this one asystole. Here that is non-shockable rhythm because there is no pulse. So we shouldn't give the shock here. So we should start the CPR here, that is chest compression. And the most dangerous dysarrhythmia is the ventricular fibrillation. See, the proper diagnosis is always important for saving one's lives. Yes, correct. Because the emergency is an unforeseen situation, because your prompt and quick action is very important to save the human's life. So I hope that you have cleared about the ECG and we discussed about some important dysarrhythmias. I hope that you will start to recognize the rhythms. The ECG seems to be difficult, but by the practice and you will start to recognize the rhythm. So please follow the tips which I shared with you. Definitely it will help you to in your clinical and your teaching settings as well. Thank you for watching me and thank you for with me throughout this series. Once again, I wish you a good day.